welcome. My name is Jessica Austin. I'm the referral team leader here. And this is Annabelle Tribe, our team leader for emergency and critical care.
Hello.
And today we're going to be talking about the life as an ECC nurse. So we're going to deep dive into this.
Yep.
And going to start off with a few questions. And I guess what brought you to emergency and critical care, Annabelle?
A fluke.
A fluke.
An utter fluke.
So tell us about your story.
My story. I'll give you the short version. Short version is I went on maternity leave. I came back. I was originally at PVC in Dramana. I thought I wanted to be a surgical nurse. Okay. When I came back from maternity leave, I got a position here, and the position that was available was an ECC night nurse. I'd never done night nursing. I've never done night shifts. I had never done ECC. But I thought, no, I will hang in ECC until a position's opened up in surgery.
Yes.
And
here we are.
Here we are. I am still here in emergency. I never left.
Never looked back.
I never looked back.
And you found your true love, huh?
I definitely found my true love.
Excellent.
Yes, which is definitely emergency. It's definitely not surgery. No offense.
There you go. How the times have changed, huh?
I know, right?
All right. So I guess let's talk about what is involved in a life of, your day and what do you do? What's the different roles that you guys have?
Yeah.
Tell us a little bit.
About that?
About all of that.
Well, it really depends on which shift that you're on. Obviously, we have different shifts. We have hospital nurses. We have triage nurses. We have night triage nurses. We have day triage nurses.
So you're running 24/7.
We are on the go all the time.
Yep, around the clock.
So hospital nurses, this is definitely more up my alley. Yep. I love my hospital shifts. It's my absolute
what does that involve?
Love.
Do you care for patients or?
We care for all the patients in the ICU.
Okay.
So day is very different to night.
Mm-hmm.
Day shift, you can have 12, 15 inpatients in and you care for all of those.
And how you manage that load?
A lot of practice.
Okay.
Yep. You do it. You just do it.
Even though you might have more patients that might come in because they just continue.
I think that's the beauty of emergency, and I love it.
All right.
And they always say, some are, we're a little bit crazy in ECC.
Oh, there's a special type.
There is a special type of person for ECC. You do have to be a little bit on the crazy side.
Oh, yeah.
But hospital, you go all the way from just, walking a patient outside to you are managing and maintaining chest drains, central lines, that sort of thing. It's a very broad, I suppose, shift.
Yep.
You are your vet's support, massive support. It's definitely more hands-on than what you would do in a general practice. I know the vets in general practice are probably more hands-on.
Yep.
But for us, pretty much what happens is our vets do a lot of the communication. They set out the plan for the patient. You execute that plan.
Okay.
So we are the ones that are there. We are the ones placing that IV. We're running those bloods for them.
Okay.
They want to give their patient 6 different medications. You are there. You're calculating that drug.
Yeah, okay,
you are administering that drug.
Making sure that you are well and truly on top of how to calculate things.
Yeah.
You have all the support from other nurses to be able to help you if you're struggling with something.
Absolutely.
Yeah.
Yeah. It's how we've all learned. I mean, I started as a junior nurse here, and here I am now as a team leader at ECC. And the reason I'm here is because I had that support of my senior nurses back 7 years ago. So, you are literally your patient's advocate. Every single patient in that ICU is yours.
Yep.
They're your responsibility. And your vet relies on you. You have to remember you're managing and look after those 15 patients in hospital.
Yeah.
Your vet's sitting there making a plan for 15 patients.
Yeah.
So
they've got a lot of workload.
They've got a lot of workload. So we take that real hands-on clinical side of things. So they can then do what they need to do. So
because they have to go in and they have to figure out what is wrong with these patients. And you're not just dealing with one case, they're dealing with 10 to 15 patients, trying to figure out every single one of them, reading and analysing bloods, examining each one of them. Is that what they do, or are you guys the ones that examine the vets?
depending when normally, because obviously we do a bit of a shift changeover from day to night. Start of day shift, start of night shift, same thing. The vet that comes on for that shift always obviously puts their hands on a patient, does an assessment, all that sort of thing.
Yep.
And then we then continue to care for that patient and do the assessments ourselves throughout our shift. Okay. And then if anything we feel is not right, we're concerned about anything for the patient, we let them know.
Yep, perfect.
So, having that skill set of picking up when something changes.
When you feel like something's not quite right.
Something's not quite right.
So when, how we have to find the background of all these diseases that we're dealing with and, know the normal ranges of everything and things like that, is that what nurses have to know before they come into an ECC position?
Not necessarily. It's definitely something that you build on over time. I mean, I can't sit here and say that when I stepped into ECC, my knowledge was that deep and large.
Yep.
I have built that up over time.
Yep.
And with that comes with exposure to things coming in. It's, no one is expected to come in here and know it all.
Yeah.
We're in an industry that's continuously changing and evolving.
I think even after me personally being here for 18 years in nursing, I definitely don't know it all. There's still so much more that we need to know. There's so much out there in our industry.
It's always changing, right? That's it. I mean, I'd love to say that I know it all, but I definitely don't. But that's the thing. Like, you don't have to, you're taught, you're supported when you come in here.
Yeah.
We all start somewhere.
Yeah.
And look, a lot of the time it is a big jump because you go, oh, well, I need more.
What's the key skills that you think you need to have as an ECC nurse? We're talking just about hospital currently at the moment. We're not going to the other job role. But I guess, what are the skills that you're looking for in a emergency nurse?
Things like being able to, I suppose, work under pressure.
Yep.
Great communication is huge.
And I guess in your day, what happens when communication isn't happening?
Mistakes happen.
Okay.
Mistakes happen. It ends up being a lot more chaotic than what it needs to be.
Okay.
Communication is so important in ECC. So
and that's communicating with just nurse on nurse, vet
nurses,
on vet, communication with owners.
Communication with reception.
Yeah.
Communication, even communication. I mean, we work in a building with other departments.
Yeah.
Communication with other departments.
Okay.
Initially, obviously, communication is key, absolutely, within your department, but ours extends out. It extends to reception because we work so closely with reception. Yeah. They're our patient's first point of call.
Yep.
Our emergency's first point of call. They speak to them first.
Yep.
So yeah, communication is so important.
So we talked about communication and working well under pressure. So what are some other skills that a hospital nurse needs?
So TPR, being able to obviously do an assessment of a patient.
So like your head to toe exams.
So head to toe exams. Yep. Monitoring an anaesthetic, obviously, because even though we are ECC, we do see surgeries and a lot of the time they're emergency.
And they're quite sick, hey?
And they can be quite sick.
So they're quite in depth with that the patient might actually die.
Yes.
Yes.
Yeah.
Because it's critical, hey?
It is critical.
Yeah. But you do see some other cases like...
We do. We have our Caesars.
Yep. They're the happy times.
Everyone loves a Caesar.
Loves getting with those beautiful puppies or kittens or whatever you're dealing with.
Yes.
We only get to see cats and dogs. We don't see anything else.
We don't see anything else. Yeah. But everyone loves a Caesar. For some reason, I don't know why. GDVs, the GDVs that come in can be quite unwell, so that can also be a little bit iffy, but we get our splenectomies, that sort of thing. Splenectomies that are more unstable and are out of hours.
Yep.
We will deal with. It's a little bit different during the week.
So if you guys are trying to manage hospital cases and then dealing with anaesthesia as well, like how does that affect your department?
So it does obviously take a vet and a nurse off the floor.
Yep.
And it leaves a nurse in the hospital.
Okay.
So obviously it does, it depends. It depends on the shift. Day shift, we are lucky. We have the support of the other departments. Night shift, they have themselves.
Yep.
So depending on what time of the night it is, if it's earlier in the night, they'll still have reception there. They'll still have their triage nurse there.
Okay.
So they'll still have a triage, reception and a nurse on ICU. And then you have a nurse obviously in doing the anaesthetic with the vet doing the surgery.
Yeah.
Once you go past that time, there may not be a triage nurse. There may not be a receptionist.
Yep.
If they're gone, then you have your hospital nurse. They'll be managing the hospital, answering the phones, doing the triaging.
Yeah, amazing.
So doing those 3 things, but you're talking that's past 12 a.m., 2 a.m.
Okay,
yeah.
amazing. And then I guess we sidetracked again and we'll go back to our skills that we expect
our
from
skills.
a hospital nurse.
Yeah, so we went going under pressure and
communication.
We're
talking about TPRs. What else?
TPRs, physical exams, general anaesthetics, that sort of stuff.
Perfect.
Obviously just a lot of those foundation skills that you've learned in your general practice days, and then
they're all utilised.
Yeah. And then what we do, we build on those.
Okay.
That's what we do.
Yeah.
We don't expect you to come in, and I don't expect nurses to come in and then say, do everything that I do or know everything that I know.
Yeah.
You come in with those foundation skills, and as soon as you have great foundation skills, you can do anything. You can build on them.
Yeah.
So easily. And that's what we do.
Amazing. And then what does the skills that you require for a triage nurse? What is a triage nurse? What do they do?
So a triage nurse, if you think to a human hospital, when you're sitting in their ER and you have a nurse come up and they are checking your vitals and everything, that's what our triage nurse does.
Okay.
So they literally triage everything that comes in the door, and then they, I suppose, communicate with the consulting vet that they're working with on that shift.
Yep. So this is a different vet to
this is a different vet to the hospitals, because we have our hospital vet and then we have a consulting vet.
Okay.
You then communicate with that vet and decide, obviously, in order of what things really should go in. So obviously your more stable to your more critical ones.
Yeah. Okay.
And obviously your more critical ones will come first.
Yep.
But then also as well, you've got a lot of client communication there, as well as triaging those patients. You are communicating with those clients and keeping them updated.
How long wait times
on how long wait times are and things like that.
That's always the biggest. I think the biggest stress that I find, from people having to always wanting to know when am I going to be seen next, right? Yes. So
and
keeping them
updated and it's really, really hard. And I think it's some things that some people do struggle with, because you do, if they've been sitting there for hours, you want to get them seen and you want it to go quicker. But then if you have a hit by car come in,
at the end of the day, priorities come first, just like a human hospital, hey?
Exactly. And that's why we have the system in place. It's why we have that triage process.
Amazing.
That triage nurse does all of that. And just helping that consulting vet. So if the consulting vet needs to give an injection or anything like that, the nurse will do that.
Okay.
Amazing. So again, really, really hands-on.
Yeah.
Unless the patient's a bit boundy and excitable, most of the time the vet will be like, I would like this injection given. No problems. They'll draw it up. They'll do the calculation, draw it up and give it.
Yeah.
Yeah.
Okay, so to summarize, I guess, so you're saying that the foundation skills that GP nurses have can be utilised in ECC.
100%.
Amazing. And I guess from what I'm trying to gather is that you're saying that an ECC nurse needs to basically handle chaos really well.
Yes, but it's not scary chaos.
Oh, okay.
It's not scary chaos.
So for me personally, I know I'm definitely not an ECC nurse because I like organised chaos. I like things being booked in.
Yes.
But you
like to have control.
I like to know what's going to happen in my day, not this spontaneous, oh, look, there's something appearing in the door kind of situation.
But a lot of the time that's what we as ECC nurses love. We like that spontaneity.
Yeah.
And we're always prepared for it. We're as prepared as we can be.
Yeah.
And once you start to get into the groove of it and you do it a little bit more, it's, you end up being those people standing there going, I want something to come in. I want something to come in, because you're pulling your hair out. You want a little bit of...
You want a bit of...
a bit of an adrenaline rush.
Squeezing those adrenals,
Those adrenals, yes. Exactly.
Okay, so what you're saying is that you get a bit of a client interaction when you're working ECC.
Yep.
And you're also getting that hospital one-on-one care that you're providing with your patients.
Yep.
Yes, it means involving either really intense care or it could be just your patient that's come in for a stitch-up or something and then they go home that day or the next day or something.
Yep.
So it's really a variety of skills
100%.
is what we're saying is involved with this.
Definitely.
And it can be from building, as you as you go through your career as an ECC nurse.
Yeah, pretty much.
Yeah. In summary, so we've got our different job roles. So you have your hospital nurse and your triage nurse. And are they allocated those specific shifts, or how does it work?
Essentially, in the whole grand scheme of things, you learn it all.
Okay.
So I'll use myself as an example. The shifts that I work, they're all hospital shifts. I don't work triage shifts. However, I still know how to triage, if that makes sense. I just don't have a dedicated triage shift.
Gotcha.
So it really just depends. So when a hospital nurse, if a nurse comes on and their shifts end up being a hospital shift, obviously the main priority is to teach them how the hospital runs and what we do and all that sort of stuff, and then they learn the triage side of things as well. Okay. So essentially you learn it all. The triage nurses know how the hospital runs, know how the hospital charts are, all that sort of thing. But it's good. That's it.
They're two different shifts.
They're two different shifts.
Okay.
But
So
everyone
I guess
knows both.
Everyone knows both, and basically you're saying during the day you don't have triage nurses.
No, we don't.
It's just you guys as hospital nurses
Yeah.
that are triage nurses as well.
Pretty much.
And then at night you have your triage nurses till a certain time.
Yeah. So during the day on a weekday, we don't have triage nurses. It'll say be myself and another ECC nurse. If something comes in, we triage it.
Yeah.
And that's because we don't get as many consults during the day.
Yeah, because our general practices
Practices are open, you know, and there's obviously so many across the peninsula. It's once they close that's why we have a dedicated triage nurse shift of the night, and they work till a certain time.
Yes.
Depending on the day, it's either like 12 a.m. or 2 a.m.
Yep.
So they're there to literally focus on the consults coming in, because they can get very, very, very busy.
Yep.
And it leaves the hospital nurses to focus on their hospital and only have to worry about their hospital patients.
Hospital at the time.
Yeah.
Not what's coming in.
Except
for your hit by cars or
Except for your hit by cars.
Yeah.
If something comes in like a hit by car, collapsed dog, even a dog that's about to arrest,
That's
then everyone jumps on.
Okay.
Everyone jumps on until it's stabilised, and then someone has allocated that patient, and then everyone goes off.
Yep.
Most of the time, everyone jumps on. The triage nurse will go back to triaging. The hospital nurses will take control of the one at the back, because to a certain degree, they have more control over, I suppose, their hospital and being able to pause that for a moment.
Yeah.
Whereas triage can't stop people coming in the door.
Yeah,
So they'll go back and they'll just keep doing their thing.
Yeah. So we talked about shift work, right? So what are the hours that are involved within that?
It varies depending on the shift that you're on.
Because you're talking a little about triage finishing at like 12 and 2 and things like that.
Yeah.
So what does your hospital nurse do?
So hospital nurse is 6 till 6. So 6 a.m. till 6 p.m.
12 hours.
12
Wow.
hours. Yep. It sounds daunting.
Yep.
It sounds exhausting. I'm not gonna lie. It obviously is tiring. 12-hour shifts are tiring.
Yep.
To a certain extent, you get used to it.
Okay.
And then you put your own personal things that you need in place to help look after yourself. So whether that's snacking on food, whether that's compression socks, good shoes, that sort of stuff.
Amazing.
Triaging, they vary from 7 to 9 hour shifts.
Yep.
Depending on the shift, weekdays at the night of a triage is they do 5 till 12. So, and then over the weekend they finish at 2 a.m.
Okay. Yep.
Just that extra support. Yeah.
So that's usually when it's the busiest day on the weekend.
Yeah.
Yeah.
So it's always the weekend. Although sometimes they do get a little bit of a curveball during the week.
Yes.
That's always good fun for them. I'm sure they don't think that, but that's fine.
No. How do you handle the stress of that? So what is your key to go to when you are stressed? What is your thing that you do to reduce it?
In the moment?
Yep.
To be honest, I feel like the realization that you're in a stressful moment comes very much after the fact.
Okay.
So you're so focused and in on what you're doing and dealing with that current situation that the stress comes afterwards, and then you go, oh yeah, that was a bit much.
Yeah, okay.
And a lot of the time I mean, personally, I can go and take 5 minutes and just get some fresh air and calm down. Sometimes it's even as just, let's just say like we've just had a CPR. Mm-hmm. We all just sort of sit there and we debrief.
Amazing.
What could we have done better?
That's something
what
that
did we do well?
You know, needs to really be a big part of you guys as emergency clinicians, hey?
Yeah.
When something, you have things happening all the time.
Yeah.
Things are chaotic.
Yeah.
They're stressful.
Yeah.
So talking with each other.
Yeah.
Building that team
Yeah.
skill and bond.
Yeah. And because you all know, you all know what it feels like. We're all there. We all experience the same thing. So you can relate so easily to each other.
So talking about it helps.
Yeah. And I mean, like, yes, debriefing and saying what could we have done better and what did we do well is great in regards to, I suppose, building our skills and improvement.
Yeah.
But just being able to go, you know what, that was really crap. Like, we did a good job, but it felt really crap.
Yeah.
And acknowledging the fact that it was stressful and it wasn't fun, but being able to do that, then you pretty much accept that emotion, you process it, and it gives you more of the ability, I suppose, to then keep moving forward with your shift.
So it sounds a little bit like you could definitely get emotional fatigue.
100%. Okay. Yeah.
Yeah.
I mean, all of a sudden you're having a great day, and then, I mean, like, I've had it. I've had a great day, and then a patient that's been in hospital 7 days, and I've nursed for 3 of those 7 days is getting euthanized or has just arrested. You know, there's those sad parts to it.
Okay.
But having that ability to, I suppose, be able to lean on the people in your team that you work with and relate to each other and all that sort of stuff and be able to process that, it makes it a lot easier.
So being open. And not hiding away and keeping it in.
I mean, I've cried on shift.
Talk about it.
I mean, we all do it. Yeah. We all cry.
But it's not a bad cry, right?
It's not a bad cry.
Yeah.
It's, you know, you got to release it.
A lot has happened.
Get it done.
That's because you guys are ready for the organised insane chaos.
And that's the thing. It's, you know, yep, that was really crap. It wasn't great.
Yep.
Sad.
But
we tried. And then, you know, we have that little bit of time to process it, and then we move forward.
Yeah.
You know, but there's happy tears. I've cried when I've had patients that have been in for 14 days and they go home.
Yeah, they go home, and it's such a celebration, isn't it?
Yeah, you're standing in reception and you're crying to the owner because they're going home. Like, there's such positives to it.
Absolutely. So you're saying there's ups and downs, which I guess all of us in our careers have had our ups and downs.
Right.
But at the same time, it sounds like you really appreciate and treasure what you, you know, the cases that you see and what you do in your day.
Definitely.
Yeah.
Yeah.
And I guess we can finish off with what is, I guess, a favourite case, or is there a particular hospital case that comes in that you like?
I know that any of my nurses that listen to this right now know exactly what I'm going to say.
Oh.
Ventilator cases.
Oh, really?
Everyone knows I love my ventilator cases.
Yes, okay. And what is it particularly about that brings you?
It's that dedicated, that one-on-one, that time, that focus.
And I know some people put their hand up for that, and others are just like, we're not dealing with this at all.
I have nurses in my department that just go, yeah, no, thank you.
Yeah, not their jam.
Yeah. I have had nurses go, you know what, I'm going to do it because I want to learn it.
Yep.
But I don't love it. I don't even like it.
Yeah.
Whereas I'm just like,
come at me,
give it to me. And that's what I love. Okay. Like, everyone thinks about the emergency part of things, and then there's that critical care, and that's critical care.
Amazing.
That focus.
Yep.
Yeah. The really intensive ones. That's my jam right there.
That's your jam?
That's my jam.
All right, so I'm going to hit you with some quick fire round questions, all right?
Yeah, I won't be able to answer them that quick, but that's fabulous.
I needed it answered in 10 seconds or less. So, okay, let's start with favourite life-saving tool. What could you not live without?
Oh my gosh.
9, 8.
Oh, that's
7.
Pressure. And I'm meant to be an ECC nurse. Stethoscope. Oh, blood gas.
Oh, she's got more than one.
The oxygen flow bar. I just don't, like, depends.
So
can I say
situational dependent?
It's situational dependent.
Okay, excellent.
Because depending on the situation that comes in depends on what I really want.
Yes.
Yeah.
What is the best way to unwind from a hectic shift?
Silence.
Oh, utter silence.
Silence. I literally get in my car and it sounds ridiculous.
No music, no radio, just silence.
Silence.
And unfortunately, you live like 5 minutes down the road.
Yeah, it's a really short silent car ride.
Oh, dear.
I mean, look, everyone's different. Yeah. I have 2 kids at home.
Okay.
So, I mean.
That 5 minutes is everything to
That
you.
5 minutes is everything. That 5 minutes feels like half an hour. Oh. It's one of my favorite times of night is driving home in silence.
Yeah.
Honestly, like my family, my partner really, he's my soundboard. So he has absolutely no idea what I'm talking about.
No, that's true.
Never does. I think sometimes I gross him out. But it's that, like having that person really that you can just verbalize and verbal diarrhea really.
Yeah. Amazing.
That's my de-stress.
Okay.
Yeah.
So good.
And definitely my silence.
Yeah, that's good to know. And I guess what advice would you give nurses considering moving into emergency and critical care? What's something that,
It's okay to be scared.
Yeah, okay.
Really?
Yep. Take the jump. It's okay.
Take the jump. It's okay. It's I think I'd be concerned if you weren't nervous or you weren't a little bit scared. I think it's a good way to be.
Yep.
Because it means you've got an open mind to be like, you know what, I'm about to learn a lot.
Yeah.
So,
don't feel like your skills aren't useful because they are.
They absolutely are. Yeah. Don't be scared at the fact that there's just so much that you're potentially going to come in and not know.
Yeah.
And focus on the fact that you actually do have a lot under your belt already.
Yeah, okay.
It is scary. Like,
have the basics.
Have the basics. Just give it a go. Just jump in. I mean, I didn't expect to be here. Mm-hmm. I didn't expect to even stay an ECC nurse, but it's the best thing that I ever did.
Yeah. And
I probably will be here till I die.
Oh, wow. Okay.
Maybe not that long. I'm dedicated to the cause.
I was going to say, wow.
Yeah, it's a long time, hey. But yeah, give it a go, really.
Yeah.
I mean, like, what's the worst that's going to happen, really?
Well, you guys like chaos, so honestly,
right?
What's more chaotic than chaos?
Exactly. What is the worst that could happen if you went, you know what? I'm just going to give it a crack and give it a go.
Amazing. Thank you so much for your time, Annabelle.
You are so welcome.
Great having a chat with you.
It was a lot of fun.
That's a vet wrap.
And that's a vet wrap. Join us fortnightly for these podcasts. You can access them through our YouTube channel, Education Hub on the Peninsula Vet Care Emergency and Referral Hospital website, and all other platforms that you can source your podcasts.